The next speaker, who again is just being mic'd up, is again somebody who works locally, because I think today is actually about embracing and celebrating our local talent. Again, something that feeds through our policy documents. And can I introduce Jane Willis? Jane Willis is a director of Willis Arts, and they are an arts and health creative agency, and she's also currently the chair of Arts and Health Southwest. So, welcome to Jane.
Good morning, everybody. Can you hear me? It's a pleasure to be here, and I feel a bit as if I'm hopefully building on a theme that is emerging, because I have been asked to talk for 5 minutes on a project or practice that has inspired me, and then to leave you with 3 questions to think about in terms of the theme of arts in healthcare working and sustainability. And what I'd like to talk to you today really is about legacy. We at Willis Newson have a sustainability policy, and it's driven not just by care and concern for the environment, but also by a very real desire on our part for the projects that we create and deliver to actually have a legacy that lives on after we perhaps stop being involved in them. And in order to ensure that sense of legacy, that sense of the project's contributing something more than just the time of the project, sustainability is something that we think about at the very inception of projects. So the sorts of questions that we might ask ourselves at the beginning of a project are, is there sustainable funding in place for this? If not, how can we help build that? Are there opportunities for us to try and develop partnerships through this project that might live on beyond the length of the project? Is there an opportunity for learning or skills sharing to happen, perhaps between health staff and artists, that means that practice might develop and grow and live on beyond the end of this project? Could this project be a means of creating resources that might have a use that might help to change and make things happen in the future? So the project that I would like to talk to you about, funnily enough, is one that Susan has just alluded to, and one that if you would like to find out more about, we've got a display in the foyer which my colleague at the front here, Joanna Espiner, is manning today. And it's actually a project, or I should say a series of projects, that Joanna has led and project managed and championed and put a huge amount of passion and energy and commitment into. So if you'd like to know more, do speak to her. And I have noticed at least one of the artists in the room today who's been involved, and that's Siobhan McElroy, who's over there. So again, if you want to know more, do I'm sure Siobhan would be happy to talk. It's about, I say project, but actually it's about a programme of work that started back in 2003 with Avon and Wiltshire Mental Health Partnership NHS Trust, when we were brought on board to develop and deliver a series of public art projects and participatory arts projects in a series of new mental health buildings being developed by AWP through the Private Finance Initiative, PFI. At the end of those commissions, there was a bit of me that thought, oh, is that it? Is that over? Is this what we've delivered? A series of artworks in a series of new buildings. Fantastic to hear that that in itself has value. But what I think is really intriguing and inspiring me about this piece of work is that that wasn't it. That wasn't the end. And one of the reasons that that wasn't the end was that we actually engaged Norma Dakin and her team at UWE to develop a full evaluation of that programme of work. And we've been fortunate enough to be able to really, after the end of the project, think about what the learning was, think about what the impact was, think about what learning we might want to take forward into the future. And that learning that's come through the evaluation of the project has recently been put into practice through another project, the Callington Road Arts Project, which has been a series of 3 artist residencies and a reflective residency working in different settings within Callington Road Hospital. And Siobhan's one of the artists that's been working on that project. what's been interesting about the development, and what really inspires me about seeing it grow and develop in this organic way, which isn't something that we were able to predict back in 2003, is that I feel we've managed to achieve a sustainable legacy. Through the residencies that have happened more recently, there has been active learning. The residencies have happened sequentially, one after the other, and the artist from one residency, her learning or his learning has fed into the following residency and fed into the following residency. There has been skills sharing between the staff at AWP and the artists involved in the project. There have been creative resources created through the project, and on the right-hand side you can see an exhibition box which Callington Road Hospital now has and can use for future work. There has been a suite of percussion instruments purchased through the project, and at least 2 of the artists, including the musician, are still working with staff at AWP, even though technically the project has finished. So whether or not another, quote, project with a definitive start and end point takes place, I actually feel that we have developed relationships, developed partnerships, that learning has taken place, that practice has changed and developed on both sides, on the healthcare staff side, but also I think on the artist side, and that resources for the future are in place. So it's that sense, it's that feeling that perhaps we have here created a legacy, but I think for me has been inspiring about that particular project. And so I was asked to leave you with 3 questions to think about through the rest of the day. And in terms of what makes for sustainable arts and health practice, the questions I'd like you to think about are, what should the lasting legacy of an arts and wellbeing project be? How do we improve our ability to work in partnership with each other? And perhaps that's also about embedding policy from different areas in the work that we do. And how do we embed learning, skills, and expertise? How do we share and embed learning, skills, and expertise? Thank you very much.
Okay.